What we say and how we say it can impact the willingness of patients to seek treatment and care. For decades, the public at large has viewed, and continues to view, addiction as a matter of personal failing, so the language we use may reflect that. This stigmatizing language is perpetuated by the general public, by the media, by the medical community, and even among those in the recovery community. It is recommended that the words, substance use, be used to describe all substances, including alcohol and other drugs, and that clinicians refer to severity specifiers, such as mild, moderate, or severe to indicate the severity of the substance use disorder. Historically, we have used language to isolate and to treat those affected in a less than compassionate and therapeutic way. Welcome, come on in and have a seat. So what brings you here today?
I need a refill on my prescription.
Oh, I see from your records that you just got your prescription recently. You should have some left.
No, I got it filled a while ago. I only have a couple left, here they are.
Are you sure you're not taking more than you should be?
I take a little bit more because they aren't working.
Well, I think that the doctor will need to talk to you about this. You may need lab work that shows a clean drug screen, in order for you to get more pills on your prescription. The patient seems a little suspicious. The lab results from the blood work came back dirty. I think you'll need to check it out for yourself, but she may be an addict.
Hi there. I see from your chart that you just got your prescription filled a month ago. Your lab work came back dirty.
They're not working for me. I just have to take more to see any effect from them.
It sounds to me like you're abusing your medication.
Okay, never mind. Forget it, just forget it.
Wait, let's talk about this.
Stigmatizing language has been identified as a potential trigger for explicit and implicit biases that may adversely affect treatment enrollment and quality of care for patients. Clinicians are typically the first points of contact for a person with a SUD, so health professionals should take all steps necessary to reduce the potential for stigma and negative bias. It is important to learn the terms to avoid and the appropriate terms to use. Can you identify some stigmatizing language that was used in the scenario? The doctor will need to talk to you about this. You may need a clean drug screen to get more on your prescription. Avoid the use of the terms clean and dirty. Stating that a patient's blood is clean or dirty can decrease the patient's sense of hope and self-efficacy for change. Once test results are in, the doctor can state that the patient tested negative or positive for substance use.
They're not working. I had to take more.
Body language is also important and can convey negative connotations. Even if the words that are said are correct, our body may reflect disbelief or bias. The patient seems suspicious. The blood work came back dirty. I think you'll have to check, but she may be an addict. Eliminating the stigma of saying addict provides respect. Put the person first, say a person who has tested positive for substance use, or a person with a substance use disorder. Avoid accusations. Engage with your patients in a non-judgmental way. Treat your patient with respect and show that you intend to help them. What else can we do? We can focus on strengths such as the patient's skills and passions. We can use language that is respectful, clear and understandable, free of jargon, confusing data and speculation. And we can use language that carries a sense of commitment, hope and opportunity. Use motivational interviewing to strengthen a patient's motivation and commitment to change, as well as their willingness to accept treatment. Create a list of pros and cons of substance use with the patient. This allows the patient to explore the positive and negative aspects of using substances and encourages them toward making a decision for positive change. Refer to a person as, he or she is in recovery, or is experiencing medication-assisted recovery. Provide hope, which may lead to a more positive outlook for a person who may be experiencing ambivalence. Speak to your patient as a whole person and meet them where they are functioning emotionally and socially. How does this affect your work in the healthcare field? Eliminating the stigma of addiction and recovery with the power of non-stigmatizing language helps your patients. It provides respect for the worth and dignity of all persons. Focuses on the medical nature of substance use disorders and treatment. Promotes the recovery process, and avoids perpetuating negative stereotype biases. How could the scenario look differently in order to demonstrate a patient-centered, non-confrontational approach to ensure clear communication, good rapport, and a mutually agreed upon plan of action? Hi, how are you doing? What brings you in today?
I need a refill on my prescription.
Well, let's see. It looks like from your records that you just received that prescription.
No, I got it filled a while ago and I only have a couple left.
Let me go through the rest of the chart and we'll have the doctor talk with you. The patient states that she is almost out of her prescription and needs a refill. It's not time for the refill to be filled yet. She states she needs more.
Good morning. I hear that you would like more medication. Because the extensive need for pain medication is concerning, I would like to learn more about your use. To start, would you be willing to fill out this short screening tool? It will only take a few minutes. Your answers will be confidential. After we do the screening, we can talk about next steps. Is this okay with you?
Okay. I will fill it out.
In this screening, you were asked a few questions about your use of pain medication, tobacco, alcohol, and other substances. The answer you gave indicate that it could be helpful to discuss your use of pain medication a bit further. I'd like to start by asking you a few more questions if that is okay with you.
Yes, go ahead.
An answer you gave indicates that you have experienced consequences and problems due to your medication pain use. Can you tell me more about this?
This scenario started out well and shows positive relationships between the patient and the healthcare worker. The caring concern from the professionals and the use of non-stigmatizing language could provide an environment where the patient feels comfortable talking about challenges and needs. Alleviating stigma is not easy, in part because the rejection of people with addiction or mental illness arises from violations of social norms. Even people in healthcare, if they do not have training in caring for people with substance use disorders, may be at a loss as to how to interact with someone acting threateningly because of withdrawal or some drug effects, such as PCP. It is crucial that people across healthcare, from staff in emergency departments to physicians, nurses, and physician assistants, be trained in caring compassionately and competently for people with substance use disorders. Susceptibility to the brain changes in addiction are substantially influenced by factors outside an individual's control, such as genetics or the environment in which one is born and raised, and that medical care is often necessary to facilitate recovery as well as avert the worst outcomes like an overdose. Treating patients with dignity and compassion is the first step.